Cap the rates, cap the cure. The president today pushing for more control over insurance rates. Is this the start then of government-run health care? Former Virginia Governor and Republican George Allen thinks so. Governor, what do you make of this?
Well, I think that it's more of the same. The American people obviously are not being listened to in the White House or in Congress. And what they're trying to do is try to doctor this rancid stew that was rejected by the people. The only people who seem to like that Senate bill were the 60 senators who voted on it. And the last thing we need is more government regulations. You just had Governor Round's on. The states are perfectly capable of administering this. In fact, Neil, I had lunch today with a fellow named Joe Guzman. He's on the school board in Loudoun County. They self-insure. They don't need a bunch of distant federal bureaucrats in Washington telling them what to do. And so what we need to do is empower people with health savings accounts and equalized tax laws, and not a $1 trillion government program with more taxes, dictates, fines, and mandates.
But what do you think of the insurance companies, the private ones that do then hit up the states of California and elsewhere for big premium increases, in the case of one close to 40%? And the president's saying, and the White House is saying, there's got to be a body, a sort of like a public service utility overseer, if you will, that says, well, all right, that's extreme. What do you think?
Well, the fact is, Neil, there are state insurance commissions. And one of the solutions to making health care more affordable, in addition to more personalized health savings accounts, are allowing more competition across state lines. And the states are perfectly capable of opening up markets. If say, California is having a hard time and they don't like what their few insurance companies are doing, one thing they could do is allow insurance companies that do business in Oregon or Nevada or Arizona to sell into that state. So the states have these commissions. I don't know what you'd get from a big bureaucracy in Washington that is not already reviewed and approved at the state level.
At your gut, Governor, what do you think of those health concerns that have proposed, double-digit hikes in premiums in this environment particularly?
Well, obviously, no one likes to see high increases in insurance rates, whether you're an individual or whether you're a business. That's one of the things I think Republicans and Democrats agree on. The question is, how do you keep costs down? A way of doing it is by having high deductibles where major medical expenses are covered, allow individuals to have health savings accounts that build up over years, that are portable. You can go from job to job. It alleviates the pre-existing condition issue. It is portable, it is affordable, and also individuals ought to have the same tax breaks as are afforded to corporations. And we'd like to see more competition. There's competition in other parts of our economy, and there ought to be more of it across state lines for health insurance.
Well,
and
to
some
that
of that
end,
can be done by the states.
I'm sorry, Governor. To that end, Robert Gibbs, the White House press secretary, hinting that if all else fails, the so-called nuclear option, where you can have reconciliation, in other words, a simple majority vote rather than a filibuster-proof majority vote to ram this thing through. What do you make of that?
I think that's awful, Neil. And look, they're flailing. They're coming up with all sorts of things here at the last second. The American people have rejected this measure as a monstrosity of spending $1 trillion that we don't have, adding taxes, treating union members different than others, putting on unfunded mandates on the states, fines on individuals and businesses. And if they try that approach, that's another flaunting of the will of the American people, and I think that they pay a heavy price politically for it, because the American people recognize that this is a bad idea for our country, and there are better positive alternatives that ought to be taken up, and there ought to be fair bargaining and open negotiations rather than this backdoor scheme that they're now proposing.
All right, Governor Allen, always good seeing you. Thank you very, very much.
Thank you, Neil.
All right, so many